A client with a progressive joint pain was evaluated at a rheumatology clinic. Extensive evaluation by the PCP indicates a presumptive diagnosis for rheumatoid arthritis. Which of the following is associated with the diagnosis indicated below? Select all that apply. So in adapt NCLEX way, we just read it from backward. Select all that apply. Okay, that's what we are asking. SATA question. Which of the following is associated with the diagnosis indicated below? That means whatever diagnosis we have, we got to make sure these symptoms correspond with that. And what is the situation? A client with progressive, the patient has joint pain, was evaluated at a rheumatology clinic. After extensive workup, indicates a presumptive diagnosis of rheumatoid arthritis. But then they want you to compare rheumatoid arthritis and then osteoarthritis. This is the problem with the new generation. They always want you to compare something, certain diagnosis that you know. So you have to know both. You have to know how it functions, the side effects, the risk factors, and other things. The current one, they probably just give you which of the following are associated with osteoarthritis. But I'm also giving information that if you give you osteoarthritis or rheumatoid, you already know it using this information. So we're going to take this fact and see if it's consistent with osteo or rheumatoid. You have to bring your content. Based on that, osteo is basically a wear and tear problem. So you have the big bone and then the cartilage here. And with excessive use and for a long time, there's a wear and tear, like your car. And the bones start touching each other, and then you have pain. Rheumatoid is autoimmune. Your body is making something, it's autoimmune, making something to destroy your joints. And so they are progressive disease, but you just have to know the fact that one is a wear and tear problem. The other one is due to what we call autoimmune disease. Okay, so let's get to it. And then let's see what we have. Okay, so let's look at it. Asymmetrical. A fact about the joints. Osteoarthritis is usually asymmetrical. It's either one side but multiple. Rheumatoid involve both sides. So you involve both your hands, both your toes, both your knees, wherever you want joint is involved is going to be symmetrical. That's what it means. Asymmetrical joint is usually osteoarthritis, not rheumatoid. So usually one side of your knee hurt, one side of your hand hurt. So that's what they complain about. Small joints. This is common with rheumatoid. Rheumatoid is very common with the small joints. So your hands and fingers, osteoarthritis is a bigger joint. So your knees, older patients, they complain of joint pain. They are all symptoms of osteoarthritis, not rheumatoid. One or more joints. This can involve both. So osteoarthritis can involve multiple joints, rheumatoid also multiple joints. But remember, it's just one side. This one is both sides. Morning stiffness. This is one of the key factors that you teach rheumatoid arthritis patients is to lay flat on a hard surface because when they don't move the joint, it gets stiff. So stiffness is more common in the morning with the rheumatoid arthritis. Pain at rest. So when they're sitting down, they already have pain. And this is consistent with the rheumatoid arthritis. Osteoarthritis, they have pain when they use the joint, and the pain gets worse when they use the joint. When they rest, the pain get better. Rheumatoid, the joint is already heading at rest, and when they use it, they have more pain. So this is pain at rest. Pain worsen after activity. Yeah, both of them. Pain is going to worsen after activity because they've used it. Sleep in a flat neutral surface is more common with the rheumatoid because of the morning stiffness. You want the joint to be in neutral position as much as possible so that it doesn't lock, and then they have morning stiffness. So because of that, we tell them to lay on the hard surface, like a hard mattress, not a soft one. That will keep the lower extremities in a flat surface. And methotrexate, this is an immunomodulator, and it will make you immunocompromised. And this is medication you use for rheumatoid because it's an because it's an autoimmune disease. This is not an autoimmune disease. This is usually wear and tear. So as you can see, rheumatoid is small joint, more than one joint, morning stiffness, pain at breast, pain worsening after activity, sleep on a flat surface, and to keep the knee in a neutral position and use methotrexate. Osteoarthritis, asymmetrical, one or more joint and pain worsening after activity. The management is like NSAIDs, okay, and Tylenol and those in steroids, but there's no immunomodulator. And this is a quick question. How do you to select or that apply? If I give you key facts about the two difference between these diseases, osteoarthritis and rheumatoid arthritis, that you need to know for your exams. Sometimes they will bring in some lab work. All of them will have ESR, it's going to be elevated. CRP is elevated. Rheumatoid factor, RF, is only with the rheumatoid arthritis. So pay attention. Okay, so this is the end of it. Just a quick question demonstrating osteoarthritis and rheumatoid arthritis. Take care of yourself and subscribe to the channel if you have not. And look out for a detailed rheumatology, musculoskeletal note video um, very soon. Take care of yourself and all the best of luck.